In this video, let us look at this book, Manipal Manual of Emergency Medicine and Critical Care. This is the second edition. So this is for medical emergencies, treatment of serious infections, and basic approach to patient care. So serious infections, medical emergencies, that's what they're talking about here. This is the second edition. So they've changed the name of the book from Manipal Manual to Emergency Medicine and Critical Care. They've retitled this book, that's what they're saying. Earlier it was just Manipal Medical Manual. Now it is of Emergency and Critical Care. It's a pretty handy book, not very difficult to manage, right? And let's look at this book now. So let us look at the contents here. Common things occur commonly. Always think of uncommon presentation of common conditions rather than common presentation of uncommon conditions. So he's always saying that you think of common conditions. That's what they're saying. Whether it presents commonly or uncommonly, that's different. But you always think of common conditions. That's what they're saying. If what you're doing is working, keep doing it. If what you're doing is not working, stop doing it. Medicine is a science of uncertainty and an art of probability. So first they have covered cardiology, cardiac arrest, cardiac tamponade, neurology, cerebral venous thrombosis. I'm just reading one in every section. Status epilepticus. In pulmonology, they're talking about severe asthma, COPD, gastrointestinal diseases, acute pancreatitis, renal injury, alkalosis, acidosis, endocrinology, diabetic ketoacidosis, shock, hypovolemic shock, septic shock, anaphylaxis, infections, severe malaria, leptospirosis, lung abscess, toxicology, bites, opioid poisoning, miscellaneous, drowning, hanging, tumor lysis syndrome, HIV, hepatitis B. Okay, so I just gave a brief of the content. I'm not gone through the entire content. Okay, so here they are showing you Wellens syndrome, type A and type B. What is Wellens syndrome? There's no ECG changes at the time of pain, little or no biomarker elevation, there is no R wave loss, usually no ST elevation, T wave changes predominate, needs intervention. There are two types of Wellen. But what is Wellen? Highly specific for critical stenosis of proximal LAD. Seriously, I need to read more of this. I have no idea. Atrial fibrillation. So they're talking about a lot of ECGs in cardiology, right? Let's look at the next section or chapter in cardiology. Hypertensive emergency, how to treat. If blood pressure is systolic greater than or equal to 180 and diastolic greater than or equal to 110, having signs or symptoms of acute ongoing target organ damage, then only it is emergency. It's not just the blood pressure is elevated. It should also have a sign or symptom of acute ongoing target organ damage. Okay, then only it's an emergency. What do you see here? CT scan shows blood in the subarachnoid space, suggesting a subarachnoid hemorrhage, isn't it? Here. Are they talking about this or this? So this book is mainly on emergencies, management of some infection here. Look at this one. Multi-drug resistant Klebsiella E. coli infections, meropenem, imipenem, so many other things. Upper GI bleeding. Please look at the details yourself. I'm turning the pages. Diabetic ketoacidosis, management, symptoms, Addisonian crisis, infections, severe malaria, leptospirosis, scrub typhus, dengue, Kiasanur forest disease, and so on and so forth. Here's a beautiful trombiculid mite. Causes what? Scrub typhus. Actually caused by the bacteria. Okay, this is the organism which is going to inoculate it into the skin of the host. Some flowcharts here. Volume replacement flowchart. So what are we looking at, guys? We are looking at Manipal Manual of Emergency Medicine and Critical Care. We're almost done looking at 3/4 of the book. Let's look a little more. Let's look at snake bite and how would you treat. So anti-snake venom, additional management for pain, tramadol, etc. And a lot of other toxicology given here. Look at this book. If you're looking at some emergency medicine and critical care information, you can look at this book. It's quite handy.